Immunization remains to be one of the most effective ways to protect children from life-threatening diseases. According to the World Health Organization, WHO, vaccines prevent over 4 million deaths every year globally. In Kenya, health experts continue to call on parents and guardians to ensure children receive all recommended vaccines on time.
Vaccination is not a duty of a parent to their children, but it's a responsibility to the society. It's a responsibility as a mother has or a father has to the society. In immunizing your child, you will have protected your neighbor. In immunizing your child, you will have protected schools from these immunizable conditions. In immunizing the child, you will have helped World Health Organization and the entire world in eliminating and eradicating diseases that are eradicatable and eliminatable. All right? So the importance of vaccination is to a larger extent not just to your family and your child, but it's a responsibility you owe to the whole community as a parent.
At Reliance Hospital, efforts to boost immunization coverage and improve child health are gaining momentum. In a sit-down interview with Horizon TV, the hospital's pediatrician Dr. Rukia Muhammad explains the diseases like measles, pneumonia, tetanus, tuberculosis, among others, as a threat, but many of them can be prevented through timely vaccination.
Currently, the vaccine-preventable diseases, the commonest one that we have been doing are, one is pneumococcal. We are immunizing children against the organisms that cause pneumonia. We are immunizing children against measles. We are immunizing children against diseases that bring meningitis. We have vaccines that are against, whooping cough. We have tetanus vaccine for the child and for the mom. We have human papillomavirus, the HPV vaccine. And we have other vaccines that have been added recently, the rotavirus vaccine, which has in a way helped in our admissions for children with gastroenteritis and acute diarrheal diseases. And these are primary healthcare strategies that have over time improved the care that we give to our children. A vaccine that I'm really proud of personally is the rotavirus vaccine. You don't see the children in shock, the diarrheas in our casualties. You don't see children dying because of diarrheas anymore because of this particular vaccine. The other vaccine that I'm really proud of is the vaccine that prevents pneumonia. The bacteria that causes pneumonia. Meningitis is another vaccine. These are all important vaccines that before used to eliminate even communities. It used to eradicate populations. We no longer have such things anymore because of vaccines.
She stresses that giving the tetanus vaccines to prevent women is important, as it protects both the mother and the newborn from the serious infection.
The tetanus toxoid vaccine that we give to the mothers during pregnancy helps in preventing the occurrence of neonatal tetanus. Neonatal tetanus carries high mortality, and people, once you get it, treatment is usually harder than if you were to prevent it. So giving the mother's tetanus toxoid vaccine usually helps us in preventing that deadly disease called neonatal tetanus.
To reach more people, Reliance Hospital has put in place regular vaccination clinics, health talks, and reminders to parents about when their children are due to the next dose.
We have an immunization clinic that runs throughout the week, Tuesdays and Fridays every week. We have a pediatrician clinic that runs from Monday to Saturday. We have talks with mothers as they wait to be seen during the vaccinations, so we talk to the parents. Apart from the prevention, we treat these diseases when they arise, all the way to ICU care. We have pediatric ICU, and I'm a pediatric critical care specialist personally, so that is my area of specialization. We have lab support to take care of these children to confirm the diagnosis in the first place. We have radiology department in the Reliance Hospital. We have a pharmacy that supports the treatment of these diseases.
The hospital also works with the local communities to ensure no child is left behind.
Issue yoyote na mtoto? Ameanza kulala usiku? But tunamwamsha kunyonya ndo tusireduce kilo hata kama analala usiku.
These diseases are not so common. So picking it sometimes it's late. All right. Before they used to be what brings the child to the hospital: measles, whooping cough, meningitis, and the pediatricians and the healthcare workers were familiar with those signs and symptoms. Right now we have children who are at home with measles, delayed seeking of care because someone thinks it's an allergic reaction. You know, someone is treating the child for something else, and then you bring the child with measles pneumonia, and they end up in the ICU, and you end up a child who is critically ill from a simple disease that ideally should have been picked. However, there are diseases that are creeping in that weren't there before. The last 5 years we are noticing measles is coming back, especially in our Somali Muslim communities. Whooping cough is coming back. You know, people are not getting rotavirus vaccine, and you are getting children with severe diarrhea, in shock and acute severe dehydration. So those are things that you can pick and say probably this child wasn't vaccinated and has missed the vaccine to treat this disease.
Beyond vaccination, the hospital also focuses on nutrition. Dr. Charles Ndirangu, a nutritionist at the facility, highlights the need for the proper feeding before, during, and after pregnancy.
In the nutrition life cycle, the mother is the bearer of life. She conceived a baby. Depending on the nutrition status of the mother, this will also have an influence on the outcome of the baby. So what the mother feeds, the key nutrients, especially during the early formation of life, they are very critical for the well-being of the baby that will be born. So in this aspect, during the first early days of conception, we recommend nutritional assessment before conception. Then after conception, there's also the key nutrients that we should all focus on.
He says that the first 1,000 days of the child's life from conception to second birthday are very important to growth and brain development.
Nutrition aspect is a very key component in welfare of the children, especially in the first 1,000 days of life. You know, the nutrition life cycle starts from the conception all the way to 5 years, and it's very critical to make sure that at every stage we give the best in terms of nutrition to our children.
Poor nutrition during this period can lead to stunting, frequent illness, and learning difficulties later in life. He explains the consequences of poor nutritional practices, from stunted growth to weakened immune systems, underscoring the role of exclusive breastfeeding in providing essential nutrients and antibodies.
Good nutrition encompasses not just the well-being of the baby or the body, but as well as the physical being. But how we nourish our body will have a greater outcome, especially to the mother and as well as the baby. Conditions arising as a poor nutritional practices, like we are having what is called milk anemia, because we continue dwelling a lot in milk, making every meal has to be served with milk, even post 6 months and weaning. So we advise mothers to follow the right guidelines in terms of this. The other thing, we are having what we call obesity in childhood because of calorie imbalance. We are feeding our baby mostly with starch and most of the convenience food that are easily available from our stores. So here at Alliance, we're able to give guidance on proper meals for the children from 0 up to school-going children, proper meals, proper snacks that they are supposed to get. We're able to provide that information.
The team at Reliance Hospital is urging parents to take advantage of the service offered at the facility. With vaccines, proper nutrition, and early health checks, many childhood illness can be prevented or managed early.
The vaccines are safe. Vaccines are available. Vaccines are free in all government hospitals, but in private hospitals at subsidized prices, usually the cost for administration and those things. And all children should be vaccinated. There's this population of children I want to target, These are children who have missed vaccination. They have come from Somalia, they have come from abroad, they have not been vaccinated. They are still open and come to our clinic and we start vaccination. We call it missed opportunity. Whether the child is 5 years or 8 years or 10 years, if you have not received vaccination, we'll start the schedule and we'll give you all the vaccines that you are due for. So children who have missed the opportunity to be vaccinated from wherever they came from, we vaccinate them here in Reliance.
Dr. Rukia and Charles paint a vivid picture of proactive healthcare, where immunization and nutrition coverage to give children the best start in life.
I can be found personally at Reliance Hospital Monday to Saturday for pediatric outpatient clinics, emergencies, and pediatric and neonatal admissions, including neonatal ICU and pediatric ICU.
At Reliance Hospital, their dedication shines through, offering hope and health to the community they serve.
It's very critical to make sure that nutrition status is evaluated, especially at every stage of pregnancy. So I would recommend that every mother who is considering partnering with us to start the visit, right, even before conception. We can have a review before conception. After conception, that is now, we are talking of pregnancy journey. We have the first trimester, the second trimester, and the third trimester. So we can have at least a visit during this stage. So we'll make sure that we give you the right information, we give diet guidance, and any possible deficiency that may arise, we're able to correct at this point.
Even though prevention is better than cure, when it arises, at Reliance Hospital, we are able to deal with these conditions to the end, to the best level of care.
In the fight against preventable diseases, timely vaccine and good nutrition remain to be the strongest defense. For parents and caregivers, the message is simple: protect early, nourish well, and give every child the chance to grow healthy and stronger. Remember, it's better to eat food as medicine instead of eating medicine as food. Reporting for the Muslim Insight, my name is Kasim Mustafa.